Alright guys, my name is Yuki. I'm gonna be explaining how to apply active release technique. So active release technique is used to address soft tissue adhesions in the fascia, promoting tissue mobility, increased blood flow, and increased range of motion around the joint. So the fascial layer is made up of fibers constructed in a web-like pattern that is connected throughout the body. And active release technique includes applying pressure to a specific adhesion in the muscle fascial network while the patient begins in a shortened position and actively lengthening the muscle being treated with the pressure. Okay, so the treatment is done on the patients with sitting, and then you basically find the muscle, which is the levator scapulae muscle, and you find the muscular tendinous junction, and you take the tissue slack out towards the occipital region, and you apply the pressure, and you make sure the patient is in the shortened position, and I'm gonna have her flex her neck and look away. And the whole time I'm applying the pressure downwards, making sure she finishes full range of motion, and repeat the process about 3 to 5 times.
So I'm going to be demonstrating instrument-assisted soft tissue mobilization, which is a soft tissue technique that uses some sort of tool like this. It could be plastic or stainless steel, and it addresses soft tissue structures in the skin, fascia, and muscle. As Yuki mentioned, the fascial layer is a layer that's just under the skin that's made of fibers constructed in a web-like form and connected throughout the entire body. This technique reproduces the inflammatory process, ultimately resulting in pain reduction, increased tissue mobility, breaking up of scar tissues, and improves overall joint range of motion and function. So since we are addressing the shoulder, I'm going to do the lats. So it's better to be on the skin, so you'll ask your patient if they're comfortable to reveal the skin of the portion of the body that you are going to be addressing. You usually should use lubricant just so it doesn't irritate the skin. So to address pain, you're going to be over the dermal layer, which is your skin, and you're going to use fast, light, paintbrush-like strokes very quickly, moving through the muscle belly and continuing all the way, just a tickle, sorry. And then you can go down as well. To address the fascial layer, you're going to angle the instrument a little deeper, and so you're going to go deeper since the fascia is under the skin, and you're still going to use that fast, light, paintbrush light strokes over the muscle. And then to address the actual muscle, to relax it and hit the Ruffini endings, you're going to completely grip the tool and angle it even deeper, and you're going to apply a deep, slow stroke to the muscle, continuing throughout the muscle.
Alright, so now we're gonna go into PNF, or proprioceptive neuromuscular facilitation, which is used to activate the muscle in a 2 segmental lines in the body. So this technique involves stretching and contraction of the muscles in a cross pattern like across the joint. And it is used to increase range of motion, strengthen the muscles, deactivate the muscles, and sometimes can be a diagnostic tool to evaluate the functionality of the joint or the muscle strength. Alright, so activation of agonist muscle around the joint inhibits the opposite muscle, which is called antagonist muscle, enabling the muscles to relax and provide greater range of motion. Alright, so I have the patient laying supine with her thumb in the pocket. So this is called D1 pattern, and I'm gonna be resisting wrist extension, elbow extension, shoulder flat extension, and it's this way, yeah, sorry. External rotation of humerus. All right, now she reaches the full range of motion. I'm gonna resist her wrist flexion, elbow flexion, internal rotation of the humerus, and adduction as well. All right, so I'm gonna show her the pattern first. This is D1. Okay, all right, resist me, go. And then it's important to have this range of motion, going through the range of motion in a rhythmic pattern. Okay, no, flex your wrist, and that's D1. So D2, which is cross the body. So she's gonna start flexing her wrist, elbow, and shoulder this way, adding add action. And then once she reaches the full range of motion, she's gonna resist extension of the wrist, elbow, internal rotation of the humerus, and extension. And it's gonna go like this. And go ahead, push, 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 and extend. And it's important to address the rhythmic movement as well. And it can be done about 3 to 6 reps each line.